Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thanks for tuning in. I'm super happy to be here today. Um, this is going to be another installment in a series that I've been doing with Evelyn, the producer, on the role that men play in women's health. That's it's like a quiet moment. But then again, I made the quiet moments. That's just I I'm nervous going into this, to be honest, because it is not an easy thing to talk about. Um, I've done this before. It hasn't always gone well. The thing is that when I talk about these things, it triggers people a lot. And what I'm about to talk about will trigger people the most. Like previously, I've done episodes on menopause and how men navigate menopause with their wives. That was the very first one I did years ago. And there was so much negative talk I got, a lot of things about women in their place and where women are supposed to be doing this. And well, if she can't, give me what I want, what's good is this? Literally. And if you don't believe me, I mean, of course you believe me. You're one of my, you're following me. You know this is true. Surprise? No, it's no surprise. But still, you go and look at the comments on the YouTube channel. It's pretty surprising how many people kind of grabbed onto that. And I don't feel comfortable talking to that because it's not something I share. I don't even know how to speak to a man when they, throw down the ultimatum of, well, if she's not going to behave this way, then what good is she to me? I don't even know where to even step into that space. I don't have a comment for it. Um, with that said, Joe Frost, I'm sure some of you know who she is. I follow her. She had a TV show. She's just brilliant. She has a great um, channel here on Instagram. She's a channel. She's a great individual, a very inspiring woman to me. But she sent me a message a few months back asking me to consider stepping into this space, and she inspired me and she challenged me to come back into this space and to speak because it's important. Navigating my job, doing what I do. I sit in the room with women every day, all day, year after year. And I learn so much about relationships. The one thing that I do know is that the role that we play as men in women's health cannot be overstated. We can contribute to their wellness and we can contribute to their non-wellness, their pathology. We can have a negative impact on their health. That is true. That's true. A lot of times it's deeper than we are willing to see. Things that we're comfortable saying and doing sometimes as men oftentimes has a lasting impact on these women whom we love. It doesn't have to be your spouse. It could be your sister, your daughter, your mom, your aunt. It doesn't matter, your coworkers. And sitting in that room, I've been fortunate to learn from this perspective on that impact. And that's helped me kind of navigate my life. I want to be helpful in this moment for you navigating your life with your spouse. I'm speaking to the husband. So the last episode, 2 episodes ago, I talked about, PMS. And this last episode, I started talking about fertility. And, Evelyn's the best. She's really good at editing, and she thinks it's a good episode. I watched, and I think I kind of rambled too much. I'm rambling now. I'm going to stop rambling in a second. I'm going to get straight to the meat and potatoes. I'll be very precise with this. I really want to be helpful to you men to navigate your relationship when it comes to fertility, because fertility is a mess. Fertility is a mess in medicine, right? It's very bad. in my experience. Many fertility clinics don't fully work up a patient. They just work them up enough to get them into an IVF protocol. That is a fact. Very few clinics will sit down and truly understand the couple in front of them. A lot of times they just start only working with the woman and then just do a quick sperm test on the guy, and they make sure they have something that's viable. They do the ICSI, which is they inject the sperm into the egg, and there they have it. That's the business model, and that is not healthy at all. There's so much more we can do. So I want to step into this space with you because it can be a scary space to be in. Men struggle with fertility in facing it, and they struggle to face the challenges of fertility. There's a lot of reasons behind that. There's a lot of deep-seated fear that we carry as men in addressing this. I want to get into that. The thing I want to emphasize, and I want to make sure you understand, is that, true masculinity involves courage, support, and being present. That's true masculinity. And I want, by the end of this, you understand, as a man, you can be in that space with your significant other and be present with them, supporting them in your shared journey of fertility. Fertility is a tricky thing, and it causes a lot of men to withdraw. It causes men to withdraw and to not participate for a number of reasons. First of all, let me say this. There's a fight or flight reflex that we have as men. And this is going to be something we talk about throughout this whole episode. You have I'm going to fight for this. I'm going to advocate for this. I'm going to work at this. I'm going to get this, right? And then these other parts, like you withdraw, like, I can't do this. I can't do it. I'm overwhelmed. We just walk away. We'll pick at something saying, well, that's because that's wrong. Which is any excuse we have, we use to walk away. That's the fight or flight reflex. Often in fertility, what goes wrong is that we go into that flight reflex, that withdrawn reflex, leaving our partner by themselves. It's compounded by the fact in medicine, almost all fertility is always focused on women. Sure, there's a little bit in the books here and there about it, but honestly, at the end of the day, all the workup, most of it all is with women. They carry an unfair burden in this. And it's not because biologically they are the primary cause of infertility. No, it's actually 50-50. 50-50 right now. So it's not because of them, but that's just how medicine is set up. There's a lot of reasons to discuss around that, but I don't want to get into it too much because otherwise I'll lose sight and track of what I'm doing here. And I really want to stay focused on the subject that we have at hand. When we leave our spouse to navigate the fertility journey alone, going to her appointments by herself, when we don't engage with her and talk with her, listen to her fears, when we abandon them, that is a type of harm. It's a type of harm we inflict. When that happens, a lot of times the impact it will have on our relationship long-term could be, profound. There's a lack of trust at that point. So it's important that we acknowledge this and we understand that when we withdraw as men, that is not a constructive thing to do. The thing is we avoid it more often than not because we have been culturalized, raised to associate our reproductive abilities with our masculinity. If we can't conceive a kid, there's something wrong with our masculinity. We're not really a man anymore. Other men will equate the idea that if I can't get a woman pregnant, it must mean I'm not doing sex right. I'm not doing it right. There'll be those men who will just equate that concept with the more kids I can have, the more of a man I am. These things are all rooted in pathology. They're not rooted in science. Think about it. You'll have a guy who is a very obviously a masculine guy, whatever benchmark you want to use to verify it, you don't say, well, how many kids does he have to evaluate or to establish the type of masculinity they have. You're judged based on your behavior, your actions, and your interactions, especially with the person that you care the most with, your spouse. That's true masculinity. No man was ever judged on their masculinity based upon how many children they have. That's not it. I'm sure there's some cultures that prize that, but yeah, I'm not going to touch that. I'm going to stick with just this. The thing is when we withdraw from our significant other, when we pull back because we are insecure or we're afraid or we don't want to face something, we are engaging in a game of chicken with time. See, the thing about fertility is that there's a clock that ticks with women, and we know that. That's a truth. There's only a window of time where they're able to conceive easily, and then there's another window of time you can conceive with some challenges around that as well. But at the end of the day, there's a window of time that's there, and women are sitting in that time themselves, and they feel it and they know it. Now, men are under the wrong assumption oftentimes that there is no timeline for men, that men could just conceive women anytime. Because you look online, there's always those weird guys at 80 years old who conceive a kid. That is an outlier. That's a weird one. And the reason why you see it in the news is because that, people want to read that. So that's eyes on the paper or eyes on the screen, which gets more advertising, marketing. That's just business, right? That's not the trend. That's not real. You can't count on that. As we age, our sperm loses integrity and its ability, its mobility, the DNA, everything about it becomes degraded. It's not a good idea to wait into your fifth, sixth, seventh decade to conceive. It never has been. It never will be. Our sperm counts drop precipitously as we age as well. So playing that game of chicken, it's not a good one. So while we're tempted to withdraw from our partner, I would ask you to think again about that. I would encourage you to reconsider that, looking at the idea of how much time you have, the impact it's having on her emotionally, the way that it's going to strain your marriage or your relationship or situationship, the harm you're doing. And oftentimes that harm is being done because there is an insecurity in the man and an unwillingness to face the question around their own fertility. I'm just talking about going in and getting evaluated. I'm dead serious right now. This is what I'm talking about, is men's ability to go in and actually be evaluated, doing a sperm test. It's very difficult to get a man to take that step sometimes, or to take it seriously. In my last episode, I talked about the commonality that we're seeing clinically of men's lower levels of sperm and the lower levels of testosterone, and both of those are associated with, hypogonadism and testicular hypofunction. And we know that this is most likely due to environmental causes, microplastics primarily. Of course, there are other ones, and we want to evaluate that. There's always going to be blockage. There could be a varicocele. There's a lot of different things, genetic. There's a lot of things that could cause infertility. I'm not trying to say it's just plastics, but I am saying there's a runaway concern we have because of the issues of microplastics. And, our sperm count has gone down by 70% since the 1970s. Okay. So we know that the lower sperm count and lower testosterone is happening at the same time. We know that testicular output is compromised through toxins in the environment. The one thing I want to remind you of is that when your testosterone is low and you have a stressor in front of you, it's easy to fall into the flight. As I mentioned earlier, the fight or flight. With low testosterone, which often accompanies low sperm, we're almost pre-wired to want to retreat. And it can become very easy to give into our own insecurities and our own fears. But as a man, I want to challenge you to do the exact opposite in that moment. And I promise you it's worth it. You just picture that with me for a minute. What is it that we prize as we are as men? We prize courage. We prize resilience. We prize a man that is able to be strong and support others. We prize men who are able to stand up in moments of adversity and do what is right. I could not think of anything more masculine than facing fertility head on with our partners, hand in hand. I could not think of anything more masculine than that. The first steps to doing that with your partner is to make a plan to be there with her during all the tests. Some tests you probably don't want to be there. She doesn't want you there. I don't know. I'll be there for every test, but sometimes you'll be like, I don't want to be there. Sometimes some of us, you'll be in a room with a blood draw, you don't want to be there. Sometimes gynecological exams, you don't need to be in the room for that. But everything else, you commit to being in that room with her. You reclaim your role as her husband, her partner, her protector when she needs it. Someone that she can rely on being there with her, sharing the burden of this. I know that I'm asking for you to become vulnerable. I know it can be terrifying waiting to get for a lab result back and what it means. Sometimes infertility is just what it is. There are times when we won't be able to conceive. And our avoiding finding that out won't make it better. It won't make it go away. What it will do, though, is strain our marriage, our partnership, our relationship. I want to talk about a few medical interventions that I see commonly in my practice, just to give you an idea of how I approach fertility and the things that I see. This is by no means meant to be an exhaustive list of like what causes infertility, but these are things that often get overlooked and no one talks about. No one talks about, but we should talk about it because, as I mentioned, a lot of times when we're dealing with fertility, we're going to these like little shops, and or maybe not little, but we're going to these shops or these clinics where they're just geared towards the business model of getting people through as many IVF rounds as possible. It just is. This is business for these guys, Lab work is the first step for us as men. Getting blood work done and getting a semen analysis done. That's the first steps. Looking at things like how's your thyroid, how's your nutrition, how's your testosterone, how's your pituitary signaling that. Looking at something called prolactin. These are all simple labs that we can be done real easy. And many of those labs can be corrected without great difficulty. Prolactin can be often elevated due to stress. Prolactin can be elevated due to dietary things too. And prolactin inhibits sperm. Absolutely. Sure does. There are also times when someone has a prolactinoma, which is a benign tumor in the pituitary. And discovering it this way is a great thing to do. It's a simple medication to correct it. It's not the end of the world. But still, we want to know that it's there. There are times when men, have low antioxidant status in their diet. They don't eat very well. Labs will show this. And you have low coenzyme Q10 in your labs because you don't generate very much. Or you have low vitamin C. And you're like, Brendan, that sounds ridiculous. Is it? Just Google it. Just put it in ChatGPT. Whatever. Just look me up there. I'm not talking crazy. I can tell you I have a lot of cases of patients, of men who ended up becoming fathers because we put them on NAC, N-acetylcysteine, CoQ10, and vitamin C. There are men who still smoke out there. I know, surprise, people still smoke. Men who smoke, if you give them more vitamin C or hopefully get them to quit smoking, fertility. Yeah, it helps a lot because smoking does affect motility of the sperm and depletes vitamin C, ascorbic acid, depletes that out of your body. That plays a role in fertility. That is a known thing. But you didn't know. No one sat down and talked to you about it. No one ran that lab. This is a good thing for you to look into, consider. Microplastics, the burden of plastics in your body, your choices on what you eat and how you prepare your food. There are so many resources out there to explain this, so I'm just going to give you a surface look at it. Whenever you eat food that was heated up in plastic, yeah, you're just punching yourself in the testicles. That's what that is. Anytime you heat up food with plastic, that's it. You are causing damage to your germ cells. You're creating an issue around fertility. It just is. There's very little argument left around that. I mean, no one. I mean, some people are confrontational by no matter what, but still, there's nothing to argue that. So going through your life and looking at anything that has plastic that's touching your food, that gets in your mouth, you want to start eliminating those things. Go back to very simple, storing things in glass containers, storing things not in plastic containers. There's different types of food containers now that are made with PLAs, which is plant derived and it's biodegradable. These things do not affect your endocrine system. But still, going back to renewables, using your own, glass containers, using, any of those little cups that you get, those metal containers you carry your water around, you can do that. You can get back to being, removing yourself from as much as plastic, and that would be very helpful for fertility as well. Other things that I know sound trite but are important, having your laptop on your lap, the heat from that, riding your bicycle. When you ride your bicycle, if you're a cyclist, you train. I used to do Ironman, and so I was in my saddle a lot. But if you're in your saddle doing a moderate workout, I think I was just talking to one of the physicians here about a study. Up to 16 weeks, you'll have compromised sperm count. 16 weeks after a decent ride. It's not birth control. Don't count on it that way, but it does affect it. Other men, those of you who are on testosterone replacement therapy, which is very common now, when you take testosterone internal to inside, it should help, of course, because testosterone does play a role in spermatogenesis. With that said, getting testosterone from the outside in can be too suppressive. Even though you're having normal levels of testosterone, it'll still be suppressive, and you still will compromise your spermatogenesis. It's not as good as birth control, so don't count on it being birth control. But many men on testosterone replacement therapy are not able to conceive because they're suppressing their sperm, inadvertently. So that would be another area to be aware of it. Simple solution for that one is, something like Clomid. I take them off testosterone and give them Clomid until they conceive, then put them back on testosterone. That's not hard to do. I do it all the time in practice. I want you to understand that change is possible, and you can do this. You can rise to this challenge, and you can face fertility with your partner. I will tell you the rewards are amazing. Outside of you conceiving, just showing up with her into these moments is powerful. As men, we all want intimacy, connection. And there's no better way to do that with a woman other than showing up, being vulnerable, and also being very strong with her and facing adversity side by side. I know this video doesn't apply to every single man. I know. I'm not pretending it does. I know there are many men that are incredibly proactive in this area, and you guys are very inspiring and great guys. There are the guys who, never have a problem with this. This is great. You guys are all great. I'm just talking to the guys because there's a significant percentage of us that just avoid this. And I want to take a moment and talk to you. And I hope this helped. I really do. That's always been my goal and always will be. To the degree I'm helpful, I did a good job. To the degree that I'm not, I love feedback. I do. It helps me do this job better. That's all I want to do. So please comment. And if you liked this, press like. And if you think I'm doing something cool you want to know more about, follow me. And if you know someone that should hear this message like this, share it. Thank you so much for tuning in. I will see you at the next episode.